Well, healthcare reform is in the national spotlight ahead of the president's second town hall meeting on the subject. We bring in Les Funtleyder. He is a long-term healthcare analyst at Miller Tabak Co. He is also the author of Healthcare Investing, Profiting from the New World of Pharma, Biotech, and Healthcare Services. Les, always great to have you in the studio.
Thank you.
Our Bloomberg News executive editor for the healthcare team sat in your chair about 10 minutes ago and said, it's very likely that nothing happens. Even though people want change, citizens are willing to pay for it. On a scale of 1 to 10, how likely is it that we see reform?
Comprehensive reform, I think, is towards the lower end of that scale. Some type of reform, maybe a 6 or a 7.
All right, so Les, we're going to ask you to hold the thought. We're going to talk a little bit more about what is likely to come and how the average investor can make money from it. We are going to be back, as promised, with a little bit more from Les Funtleyder of Miller Tabak in just a few moments. So we're going to continue on that healthcare issue, obviously. We're back right now with Les Funtleyder. He is a longtime healthcare analyst and author, but the analyst for Miller Tabak. So we were just talking during the break, Les, about what we've seen from the CBO saying $1.4 trillion could be the cost of the new healthcare plan versus the $1 trillion estimate we heard. You have an even higher one.
Yeah, I tried my own hand at running some numbers, and you know, your average working age person costs the system about $4,500. So if you took those numbers and multiplied by 47 million, you'd get, you know, 2.1 trillion. And then the CBO said they thought 10 million more people would be forced onto a public plan from employers who didn't want to pay. That's another 400 or 500 billion, so over 10 years. So we're talking, my
around
numbers are
$2.5 trillion.
Yeah, quite a bit different than the CBO's. But then again, the government may not have to pay all that. It depends on how they who pays what.
I heard you say that you don't think we're going to see drastic reform, but that you think we will see some form of change. What's the most likely scenario?
I'd say the most likely scenario is they come to some agreement over expansion of coverage, either for chronic care or an expansion of Medicaid. But I don't see a massive comprehensive overhaul, just because at the moment they're doing everything they can to keep the deal from falling apart, and you see splintering of the various interest groups like pharma and the hospitals. Based
on, in your view, that most likely scenario, what is an investor's best bet?
Well, our view has been that since we've had attempts at reform since Theodore Roosevelt and that comprehensive reform hasn't happened, it's probably not going to happen this go-round. Investors have a tendency to overprice risk, and we think it's generally going to look a lot better for all of the healthcare, or most of the healthcare industry on the long side going into the third quarter, predominantly managed care and to a lesser degree pharmaceuticals. Medtech and biotech sort of levered to things like comparative effectiveness and how that shakes out.
Any change for insurance companies?
Well, a lot of it depends on whether or not there's an expansive public plan, which is looking less and less likely at the moment. So probably more oomph on the long side than any other group, assuming no massive overhaul.
All right, Les, well, we have to have you come back. We know the president is doing the live town hall meeting Wednesday nights, maybe Thursday morning. We'll give you a call, Les. We thank you very much. Les Funtleyder there from Miller Tabak.